Manpreet, you can send the case notes which you have written there along with the letter, so that I'll take that particular case notes, because there are different case notes. I don't
Okay,
know.
sir.
I don't know which case notes you have taken, so please send that. I'm waiting. And this is not a letter correction. This is training you how to write the sentences, word to word, line by line, sentence by sentence, paragraph after paragraph, relevant and irrelevant information, order, sequence, organization. Follow it. So there we are. It's not 190 words. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are going to correct the letter of Manpreet Kaur from Sirsa, Haryana, India. She is a nursing tutor working in a nursing college, and she's preparing for her nursing specific OET exam. The letter for today, we are starting a new series that is NN.QQ, quintessential quality check for nurses at different, and we'll be posting all these letters. We'll be posting all these letters, corrected letters, in two locations, two groups. One is syringe solutions. This is where you get all the only writing corrections will be here, only for nurses. That classical correction is a conglomeration of, it's a multiple groups. There are several, maybe 20 to 24 groups joined into one, merged into one. Okay, they all flow there. That is an ocean, but these are the rivers which feed those things. So here you will get all the letters related to nurses. Okay, so it starts here now, starts here. And all the letters, yeah, this is the channel for nurses. You can subscribe there. This is the channel for all these corrected letters will be in one place. That's it. That is for nurses. Syringe is the symbol for nurses. Syringe is the symbol for nurses. That is for nurses. And there will be another channel where I put all these videos that I will put later. And next, if any doctor is there, these are for the doctors. That is a different channel. And for pharmacists, there is a different channel. This is for the doctors. First, I started with the doctors. How can they take it? Yes. This is the first letter. Okay, then these are the letters. Second letter. They're going now, flow. They're going in a flow. Now this is the fourth letter. That is what was corrected today. All these letters will be there. So, right. So this is the PDF. That is the Word format. And this is the PDF. Okay. Right. So, having introduced, this is for the doctors. Okay. And here the fees particulars are there. I stopped taking admissions in the older style. And there's a criteria for taking admissions now. Not everyone who pay the fees will be given admissions. You have to do a mock test. And if the candidate is listening and following the styles, and if I believe that he's serious, then I'll give you the admission. So style is totally changed. So you can follow in the box, everything is there. And this is the link for the doctors. There are some doctors also. Okay, this is for the doctors. Right. Yeah. Now, coming to the point, the word count will be taken from here, from the introduction, paragraph number 1, paragraph number 2. I'm teaching you. I'm not correcting a letter. I'm teaching you many things which you will not be knowing. Many things. Second paragraph, third paragraph, fourth paragraph, fifth paragraph, sixth paragraph. Okay. So this last paragraph, this, if you require further information, please do not hesitate to contact. This will be not this will not be considered in the word count. So the number of words is here, 193 words. Fine, good. 193 words. So that I'm going to place here 193 words. So it is reasonable. It's reasonable. It's not more than 200. It's not less than 180. Every student who is attending either on the platform, Zoom session, or attending the YouTube session, you follow all these points which I'm telling you, because each and every point is absolutely important. So I asked you to send Manpreet Kaur into the same here, to send the same case notes here after your letter. So where you have sent in the classical corrections conference, you can send immediately after your letter. All of you send your letter and send your case notes. Letter and case notes. I don't know which case notes you have taken. Okay. So there are, the letter is, okay. Andy Williams. Andy Williams. So here is the case notes. I don't know whether you have taken this case notes or some other case notes. So if this is the case notes, that's fine. Okay. So you can please check it out. So you can, because there are different case notes. And the other case notes is also here. Andy Williams. Yeah. Here is another case notes. I don't know, is this the one? Yeah, this is another case notes. I don't know which case notes you have taken, because there will be clash with the case notes also. Okay, that's fine. Now having, yeah, we'll go through that. Yeah. Okay, we can consider those two. Right. So once again, this is the number, this is the token number or the letter number. Confirmation that I received your letter and it is for correction. If you do not get this number, that means you have to follow it up. And this is the name of the patient. And this is the case, weight gain and nursing profession, Manpreet Kaur. the candidate, and this is very important, word count. That's why it is coming there. Next one. So let me take, okay, this case notes. If any clash comes, I have to check it both now. Yeah. So here it is. Dr. Kurak. Dr. Kurak, surgeon. Surgeon, Weight Center, 393 Victorian Road. I'm showing you each and everything. I'm showing you each and everything. So Weight Center, 393 Victorian Road. Weight Center. Why did you write W capital letter? W small letter. It should be capital letter. And the name of the thing after something, it's no need the Weight Center, just Weight Center is enough. Or that's, if you write also, it's not a problem. Okay, 393 Victorian Road. Yeah, this is wrong here. It's a mistake. Cap correct. Victorian Road. Richmond, Melbourne. Yes. Yes. So, Dr. D. Kurak, surgeon, the Weight Center, 393 Victorian Road. Bear with me, peace and calm and no hurry. No one will be given mic to speak or no questions, no compromise. Okay. All right. Just follow my guidelines because you need to know all these things. So Richmond, Melbourne. You're writing a referral letter, remember. 15 June 2018. So it's a single visit. Presented a single visit. 15 June 2018. So these mistakes should not happen. These are very simple things. Don't do that. Dear Dr. Kurak, regarding Mr. Andy Williams, aged 65. Is the date of birth given? 65. Andy Williams. It's a clinic. Okay. Yes. Eastern Medical Clinic. Melbourne 3002. So Andy Williams is a 65-year-old man who presented at the clinic in which you work. So you are a nurse. Absolutely fine, registered nurse. Why don't you put a capital letter? Why don't you mind it? Is it not important? Who will write that? Eastern Medical Center. Eastern Medical Center. Who will write this? Melbourne 3002. Right. Age 65. Andy Williams. Got it. The next one. So instead of correcting 10 students' papers, one student I correct and the others follow the pace, style, and the pattern. That would be very nice. It reduces, minimizes, or diminishes or decreases my hard work, and it enhances your quality. So follow this. All the other students, when I correct the letters, try to follow these things. That is the reason why I'm coming online. Right. Regarding Mr. Andy Williams, aged 65. So this is also wrong. That line, yours sincerely. Dear Dr. Kurak, dear Dr. Kurak, sincerely. Okay, right. I am writing to refer. That's right. It's not wrong. It is not wrong. It's right. Absolutely right. But the point of question is, what is the quality? Yeah, everything is right. But to what extent it is right? Nothing is wrong. Everything is right. Even a person who gets 1 mark out of 100 is right to the extent of 1 mark only. So then what is the grade or level of this one? So this writing, on which scale of the balance? The left side or the right side? The right side, the better. 0 to 100. Okay. That's very important. I am writing to refer. Who is this I? Is this I important here? This is a formal letter and you are providing information about somebody, and why you are poking your finger into this? Giving self-importance. I is not necessary, because the person who is important is Mr. Andy Williams. He is the primary concern, and pushing him into the second place, no third place. You are bringing I into the first place and you into the second place. I am writing to you to refer. I am writing to you. That is the meaning. So I am first, you next, then only Andy Williams. What nonsense you are making out of the importance, the grading of the quality. You know, even in a supermarket, small tomatoes will be, say, $1, medium will be $2, and big tomatoes will be $3. That is it. Okay, you're hiding the $3 one and putting the $1 one, who will buy that? Okay, that's important. I am writing. In this part of the structure, self-praise is observed. In formal letters, official letters, standard letters, the value of the self is diminished. It is behind the screens like a director who will not come. The actors will come in front. So you are the director here. You are writing the letter. See, stay in the background and don't project yourself. When you are praising yourself, you are going up. The patient is going down. Ultimately, the entire letter standard is going down. So don't bring yourself into the picture anywhere in the letter. It is right, but the quality is very low, not even mediocre. It is base value because of two reasons. Unimportant person is coming into the first place, number one. Second thing, you are using personalization, which is not accepted in formal letters. You are making it a personal letter. I am writing. He, you, all these things. So when you're bringing I, it has become a personal letter or friendly letter. It's informal letter it is becoming. So formal letter, official letter, they should bring out these things. It's right. Once again, I'm telling you it is right. I'm not telling it is wrong. But with this quality, you will not pass OET. Okay. Right. It's difficult. It's difficult. Not pass. No, it's difficult to pass because already there's low quality and again mistakes gone. Low quality without mistakes, maybe you will pass by 350, 360, 370. You can never get beyond 370 with this quality. So, and mistakes are there still, then again going down to 330, 320. Okay. So avoid that one. Next, writing. I am writing. I am writing. Active voice. Active voice. Avoid active voice as far as possible. Because OET tells that. Okay. Right. So remove this one. Mr. Andy Williams. Okay. Now you see obesity and has associative disorders. Okay. Right. Don't use the word sufferer. It's a negative word, like patient. If you tell anybody patient, it's not, it's not formal style to tell somebody as patient. Okay, patient is right. That's an official documents you can use, but don't go and tell somebody you are the patient, you come here like that. Don't say. Okay. So it's like degrading the person. Okay, don't use. So avoid such words. Right. And next one. Yes. You can see here height, weight, body mass index. Then you can see family history, social history, family history, medical history. So social history, family history, and medical history. And medications, weight history, diet, food intake. Okay. Now you see plan. Wants to learn about surgical options, partner encouraging. What's this? Partner encouraging. Recently divorced. Don't understand who has written this case notes. Okay, fine. It's contradicting statements. Okay, fine. This is not authentic letter, but still letter is there, so we have to correct it. So you can go through here. Weight history. The problem is related to weight. Childhood obesity, gaining weight, highest adult weight reached already. Okay, so it's the problem is with weight. It's very clear. Problem is with weight. Reluctant to consider weight loss surgery in past. So it is regarding weight and weight loss. Obesity you can use. Weight gain you can use. Gaining weight. Those both the words you can use. Obesity or weight gain. Every decade, every 10 years is increasing. And now at highest weight gain. Okay. Obesity and weight gain. So this one. So you can use that one there. So Mr. Andy Williams, family history of obesity. Right. So Mr. Andy Williams, how can you consider? There are three things here which are very important. Who is the case? Mr. Andy Williams. Next one, what is his problem? That is obesity. And second one, or weight gain. And next, third one is what is required. Okay. What is required? Requires. That is it. This is important. So here you can put a comma, another comma, and just, so here in between, who, so here, this is a visit. Who presented or visited on 15, presented on 15. Just you can use the same word, change the words. Don't use the same word, change the words. Who visited, okay, on 15/6, who presented with the concerns regarding obesity or weight gain, okay, who is concerned, who has concerns regarding obesity or weight gain, okay. Then next, last, here you see, write a referral letter, is being referred. You can say is being referred for. Okay. So who dash, I'm putting like this because we have to fill in that. Mr. Andy Williams, who dash dash dash, okay, who has concerns regarding weight gain or who has concerns regarding obesity, whatever, let us fill it later. So is being referred for, requires means for, enough, is being. So this word referred is here. This word is very important, that has come here, referred, is being referred. So requires, needs. So he's referred for means is equal to required. Okay, evaluation of obesity and recommendations for treatment. Okay. So and recommendations for treatment. He has been long sufferer of obesity and has associative disorders. Now you can say here, this one, you can just take here. Okay, I'm just playing something with the style. Okay. Mr. Andy Williams, who has concerns or who presented with the concerns related, I'm going to give you advanced styles, Mr. Andy Williams, who presented with the concerns related to obesity and associative disorders, is being referred for evaluation. No need again obesity. Repetition. Repetition. Obesity is already there. Repetition. Okay. Is being referred for. Okay. Why you are sending him there? Referral to the Weight Care Center for evaluation of obesity and recommendations for treatment. Why are you writing the same things? Why are you writing the same things? Recommendations for treatment is here. It is just like copy paste. Taking from here, putting them as they are. Treatment means management. Okay. Recommendations, you can write suggestions for appropriate management. Why don't you use that one? Why you are using the same? Do you think you are going to get the marks for this? Definitely no. Because these words are not yours. You have copied his words and you put here. Because I see there, I'm telling you very clearly. Recommendations for treatment. Recommendations for treatment. What gives? So you can say suggestions for appropriate management. Why don't you change recommendations? Why don't you take synonyms, synonyms, synonyms? How many synonyms I have taught you? I'm not correcting anybody's letter here. I'm teaching something which is very, very important because I'm fed up of giving a lot of explanations, but nobody in the real sense, nobody is implementing that. They don't know that they should not copy the words and sentences which are given there as it is. Why we are losing the marks? Why you are not getting the scores is because of this. There is something, three words as they are. Now what I did, I transformed that. Suggestions, necessary suggestions for appropriate management. Finished. I gave, there were three words, I gave 5 words. Only one word for is a preposition which cannot be altered or adulterated. So I used it for as it is, and I changed the words, 2 words which were given, and I added 2 more words to lift it up, to, push it up. Sir, their letter is very small, sir. The case notes is very small, sir. How can we improve? Necessary means needed. Okay. Appropriate means correct, apt, proper management. Okay. Why don't you change that one? Right? Is being referred for evaluation. Okay. And so evaluation is already there of obesity. Same thing you have written, somebody, whoever it is. It's not Manpreet, it's not somebody else, it's not somebody else. Evaluation of obesity, the 3 words you have copied and pasted. Do you think that when Simon sir can recognize this one, you think they do not recognize this one? They are experts. Their duty only is to cut off marks. What speciality is there in this particular? 3 words plus 3 words, 6 words as they are copied and pasted. So here you can say further examination or assessment. Learn the words. How many words in your reading I have given you, in your listening I have given you? Why don't you use these words? Why don't you use these words? Okay, it's very, very important. Nitya, you're a new student. Ushani, you're a regular student. Neetu, only regular students will be there. Others will not be there. I know, because they don't know the value of what we are. They just come, they just go. Okay. So mostly only regular students will be there. Kausar, Jabin from Pakistan, Karachi. This is what it is. So Mr. Andy Williams, who presented with the concerns related to obesity and associative disorders, is being referred for further assessment and necessary suggestions for appropriate management. If is being referred is not there, then you can say requires. That becomes active voice, but passive voice is better. Is being, okay, fine. So this is not necessary anymore. Concerns related to obesity means suffering obesity. Concerns is a suffer problem. So suffering is gone, that also. So you can avoid those things which are in brackets and change, modify. Mr. Williams who has a family history of obesity who has a strong family history. Yes, not only father, but also sister. You can add a word, strong family history, not just one, it's double. Okay, fine. Mr. Williams, who has a family history of obesity, has been increasing his weight since childhood. Mr. Williams has been increasing his weight. You think he has been increasing his weight? Is he increasing on his own with his interest? Or is it happening? So that's the concern there. So that's fine. Is it happening? Gaining weight. He has been gaining weight, but he is not increasing it. He is gaining more added to it, but he is not He is not increasing the weight. Weight is increasing. Weight is increasing. He is not increasing weight. Okay, that's a passive phenomenon. It happens on its own. You cannot do anything to it. Like that, maybe. Are you adding to its weight? That's the point. Okay. And have been reported to have. And has been, not have been. The highest. the highest adult weight. Okay. Although he participated in commercial and medical weight loss programs, so here although is there, but where is the connecting sentence? Although he participated in commercial and medical weight loss programs, there was no benefit, or something should be there. Although I went to the supermarket, I could not bring the vegetables because it was raining. So try to understand that. Although is a conjunction. Where is the other sentence then? Without although is also it's making sense. So although he participated in commercial weight loss programs, comma, okay, what is missing? The consequence is missing. He participated in commercial and medical weight loss programs. That's okay. That is the cause. And what is the effect? That is missing there. Okay. Within is one word. Within a month. Within months. Weight gain. Regained weight within months of discontinuing program. The same sentence you could have written in a different style. Regaining weight. Okay. Though he participated in commercial and medical weight loss programs, okay, he regained weight within months of discontinuing program. How can you modify this one? Weight gain was reported. Weight gain within months. Okay. Weight gain within months, within few months was reported. Although he participated in commercial and medical weight loss programs. So here you can continue like this. Weight gain was reported. Weight gain was reported within a few months after discontinuing the programs. That is how it should come. Although he participated in commercial and medical weight loss programs, weight gain was reported within a few months after discontinuing the programs. He started the programs, he participated in the programs, but whenever he discontinued the programs, weight gain was reported within a few months. That is how you have to set the sentence. So although he participated, so if you use although he, you are using, so in despite participation in commercial, and so you can use despite in order to remove he. This is correct. Although he participated in commercial and made gain programs, that is correct only. So if you want to remove this one, you can just remove this one and say despite participation. despite participation. Despite participation in commercial and medical weight loss. So he is gone. Why do you want to write he personal pronouns? Despite participation in commercial and medical weight loss programs, weight gain was reported within a few months after discontinuing the programs. Okay. Regarding this issue, he consulted with why with consulted the dietitian. However, due to concern about complication, he did not proceed further. Regarding this issue, he consulted the dietitian. Regarding this issue means already you told. Therefore, that's enough, no? Therefore, regarding this issue, correct only. It's not wrong. Why you want to expand too much regarding this issue? Okay, therefore, already you have said therefore. Just use the word therefore. However, due to concern about complications, he did not proceed further. His current weight is 155 kg and height is 183 centimeters. Yeah. And body mass index is 46.6 kg per meter square. Okay. So you have to modify the sentences in such a way that the clarity is maintained. Therefore, consulted the dietitian. Consulted registered dietitian. Okay. So here, so therefore, the dietitian recommended some recommendations. Anything is there? Weight loss surgery. Relation to consider weight loss surgery in the past. Bariatric surgery. Okay. Due to concerns about the complications, he did not proceed. Did not proceed further. Complications from bariatric surgery. He did not proceed further. Okay. He consulted the dietitian. Okay, fine. However, due to concerns about complications, he did not proceed further. Complications of what? Complications of what? What complications? Concerns regarding what? Of complications. Complications of what? Bariatric surgery. Clarity is missing. Or weight loss surgery or bariatric surgery. Something is missing here. He did not proceed for his current weight is 155. Okay, fine. So Mr. Williams was a family history has been increasing his weight since childhood and has been reported to be the highest adult weight. Reported to have. Reported to be at the highest adult weight. Reported to be at the highest adult weight. Fine. Mr. Williams has obesity related disease. Obesity related, hyphenated. Here you have to put a hyphen. Obesity related, hyphen. Disease, including Mr. Williams has obesity related disease, including, how can you say including here? He has many diseases, including type 2 diabetes, like that. He has multiple diseases, including, but here obesity related disease is only one disease. And again, you are saying that this is including will not suit here. I have lot of money, including the money you have given me. A lot of, that means what you have given, that money is, I play a lot of games, including football and basketball. That means many games are there, and among those games, football and, so where is this one concerned? Obesity related disease is itself one disease. And type 2 diabetes mellitus is not included in obesity related disease. How can you include all these things in obesity related disease? I think you understood what I am telling you. Mr. Williams plays games including football and basketball. That means games. Games should include all these things. So you say Mr. Williams has multiple diseases, including type 2 diabetes mellitus, hypertension, gout, and all these things you can add in that one. But there is nothing like that which takes all these into together into that. So you cannot say included. Mr. Williams has obesity related disease, comma, type 2 diabetes, hypertension, gout, and sleep apnea. Finished. He has been taking 30 and 70 NPH insulin. Now, what is this NPH insulin? Do you know what is this NPH insulin is? Okay, over-the-counter vitamin B12 supplement. NPH insulin. Okay, what do you mean by this insulin? NPH insulin, do you know that? Before breakfast, before or after dinner, morning and even night. Okay. Okay. Right. NPH insulin. What does that NPH stand for? If you know, you can write. Otherwise, let it be like that. If you write that, you will get extra marks. Okay. Extra weightage will be there for that. And if you know that, right. NPH insulin. There is Google the greatest pagal. Okay. NPH insulin. Okay. Neutral protamine hagedorn insulin. That's it. So NPH stands for this one. If you know, you'll get extra marks for that. That's what is the case notes. Okay. Right. Neutral protamine hagedorn insulin. Before breakfast and before and after dinner. He takes metformin, atorvastatin, lisinopril. He takes. The current medications are, you can say, now why you are using he every time? He has been taking. Okay. Okay. The current medications include. So he takes is normal. It's correct only. It's absolutely correct. Okay. What I'll do is I'll just put them in brackets. So the current medications include. The current medications include. So here he has been. Why all this he has been taking? In addition to 30 and 70, in addition to 30 and 70 units neutral, protamine, hagedon, insulin before breakfast and before and after dinner. Okay. So you can say, in addition to this, the current in medications include this. Okay. That means those are also included. These are also included. So the current medications include this in addition to this. I play, the games which I play include football, volleyball, and basketball in addition to shuttle and badminton. What's wrong in that? What's wrong in that? Two sentences joined into one sentence and all the personal pronouns are gone. In addition to football and basketball, comma, the games I play include volleyball and hockey. What is wrong? So in the other way, I can say like that. The games I play include basketball and volleyball in addition to hockey and cricket. What is wrong in that? In addition to 30 and 70 units NPH insulin before breakfast and before and after dinner. Before or after dinner. Before or after dinner. See, even I made a mistake. I did not notice that. Second round, if we do check and cross check, we'll get the answers. So simple as that. See, the quality has gone up. It has gone to 400 almost. Mr. Williams takes 3 meals per day, in which dinner is the heaviest. Superlative degree. Mr. Williams takes 3 meals per day, in which dinner is the heaviest, the largest, the biggest, the most handsome, the most beautiful, the cleverest. Whenever you are writing superlative degree of adjectives, remember the is the must. Why do you want to write Mr. Williams? Okay. Avoid that one if you can. He reported eating once a month. He reported. Why? Why he reported? This is not wrong. It's correct. It's active voice. Just make it a capital letter. Binge eating once a month has been reported. Finished. Why so simple thing? How many times I have corrected? How many times I have told? Passive voice, passive voice, passive voice. He concerned about his health. He concerned. He is concerned. As he wants to learn about surgical options. He's concerned about his health as he wants. As he is concerned about his health, he wants to learn about surgical. This as is actually not here. You can write so here instead of. If you want to write as, you bring this as here. Otherwise, you remove this one and write so. Or hence, or therefore. Or you write because he is concerned about his health, he wants to learn about surgical options. Interest in surgical options has been expressed due to the concerns regarding health. So simple. Interest. He wants to learn. Simple language. I want an ice cream like that. Huh? Simple language. He wants to learn. I want an ice cream. Okay, take it. And only ice cream. Take it. He wants to learn. Interest regarding surgical options has been expressed because of concerns regarding health. Why his health? See, one sentence you are writing how many? One he, another his. He will be concerned about his health only, not your health or my health. My goodness. So he wants to learn. Yeah, of course. He only wants to learn. Why he, his, he so many times? Just you can modify this sentence like this. Interest regarding surgical options has been expressed due to the concerns regarding health. When you speak, artificial intelligence should correct it and give it to you. That is how you pronounce properly. You can check it there. Many people speak in the speaking test. And I don't know how to correct these sentences because in the artificial intelligence I have seen we speak something and there something else comes. So we are not pronouncing properly. So interest regarding surgical options has been expressed due to the concerns. Where is he? Where is active voice? Where are personal pronouns? You have written 3 times personal pronouns. He, his, and he. Where they have gone? Gone to the west wind. It has blown and tsunami is going somewhere. Let it go. Okay. Don't want. Don't want. I'm teaching for 1 hour, 1 letter means you should understand how much important you are for me. Okay. And how much important this letter is for me. Because there may be number of students watching these programs. Maybe not attending now, but afterwards they'll be watching. Williams takes 3 meals per day, in which dinner is the heaviest. Okay, fine. Here also you can eliminate, but no need. Okay, no problem. Once or twice. It would be greatly appreciated if you could evaluate him for giving and give recommendations for treatment. Okay. Recommendations for treatment. Again, the same thing you are writing again. Only one time you should not write that same thing. You have written the same thing. And again you are writing in the ending this. This is repetition. It is repetition. There is no value to this now. You think they don't notice these things? It's okay. Be happy. I'm correcting your letter. You're really fortunate. I had to correct somebody else's paper. They dropped down, so I gave you this paper. And this is my first correction in this style for nurses. So somebody is putting his mind, body, and soul into that one. Listen to this audio 2 or 3 times, no problem. Full video 2 or 3 times, and try to imbibe the quality which I'm presenting to you. When you give diamonds, no, people think, oh, these are only glass pieces, because they don't know the value of diamonds. Let them not bother. Only the diamond merchant knows the value of diamonds. I know what I'm teaching. That's why I'm 1000% I'm immersed into this. There may be some people, what is this nonsense? Simon sir is teaching coconuts. That's what some people think. I don't mind. I don't mind until and unless I'm doing quality work. I don't mind which Tom, Dick, and Harry says whatever. I don't mind, because I know I'm doing my best for my dear darling children, because I love myself first. And because I love myself, for my name, I give the best for you, because you pass on my name through the word of mouth from one person to another person. I want to give the best. It would be greatly appreciated. You are appreciating whom? You are appreciating the surgeon. Why he is not taking money? He is not taking salary. He is doing something free service. Why should you appreciate him? Huh? Is this formal letter or friendly letter? Why do you want to appreciate somebody in formal letters? No appreciation. Everyone is officers. Officers. The person who is writing an officer, the person who is receiving the letter is an officer. Everyone is an official. It's an official letter, formal letter, a standard letter. It would be greatly appreciate you. Why should we appreciate his work? He is doing his duty. He's taking his pay. Simply, he's not doing any favor to anybody. No need to appreciate. Why you should appreciate somebody doing his work? It is his work. Already government gave him a recognition, a certificate as a surgeon, and go work as a surgeon. Why you should appreciate? Already government recognized. He's already named as a surgeon, registered surgeon. Registered surgeon. Okay. Yeah. Surgeon. Okay. He's a surgeon. So why you should appreciate him for doing the surgery? It is his job. If somebody does his job, you should appreciate. No, no need. So change the style. This is some pleading style, begging style, requesting style. Oh, please help me, like that style. Don't fall on the ground. Rise up. Okay. So it would be greatly appreciated. Don't appreciate. I say that is up to you afterwards. Many people are writing. I will also write. Go write. Many people are failing. You also want to go and fail. Go fail. Somebody is telling you something, taking time. I can correct 10. Somebody others can correct 10 letters in this time. They are correcting 10 letters. I don't mind. That's it. So it would be greatly appreciated. No need to appreciate anybody. If you could evaluate, he can evaluate. If you, there is no if he could evaluate. There is no need. He can evaluate. If you could evaluate, not possible. It is possible. If you could means if it is possible, why it is not possible? It is possible. Why should we say it's not possible? Eh? So what is the need? So just say based on the aforementioned circumstances. After discussing all these things, keeping the above condition circumstances, taking the considering the above mentioned circumstances, even level higher. I'm taking it a higher level now because the level of style of corrections is going to hit the bull's eye. People will come. Okay. Considering the aforementioned circumstances, considering the aforementioned circumstances, evaluation. Okay, evaluate is the same word there. Evaluation, same word. You are repeating the same word. What gives you? Evaluate for him, no need for him. So change the word evaluate. Okay. Assessment we already taken here. Further assessment. So necessary suggestions. Okay. Assessment is over. Evaluation, no need to write. Examination. You see? Examination. Examination or a diagnosis. Okay. Take one more word you can put there. Examination. Appropriate management. Here we have used. And okay. Considering the aforementioned circumstances, okay, evaluation or examination and change. Recommendations for treatment. So recommendations for treatment here. I removed there only, then again it will not come. Necessary suggestions. Advice. You can hear advice. Advice. Don't say advices. This is wrong because advice is a uncountable noun. You cannot say one advice, two advices, three advices. It's utter nonsense. Advice, CE, not SE. Advise, z. This is sa. Advice. Advise is a verb. advises. That is different. That is third person. He advises, she advises, it advises. That is different. And expert, advice. Let me go to the case notes once again. Wants to learn about surgical options and education. Okay. Surgical options. Education regarding surgical options. Okay. Advice regarding surgical options. The available surgical options. Examination of the present condition. Considering the aforementioned circumstances, examination of the present condition and advice regarding the available surgical options would be profoundly beneficial. Considering the aforementioned circumstances, examination of the present condition and advice regarding the available surgical options or follow-up treatment plan would be profoundly beneficial. Right? 100 there are 100. Next time I correct another letter, another form will come. Then same form will not come. Who remembers all these things? When I'm correcting somebody else letter, another form will come. 100 people are writing, 100 different styles will come. And you see here one paragraph, second paragraph, third paragraph, fourth paragraph. And this should be continuation of the previous paragraph. 5 paragraphs only you write. This is not a 6th paragraph. I don't understand why you consider it as a next paragraph. Take it here itself. 2 sentences in this last paragraph. This is how it should be. But nobody thinks that it should be like this. This is the conclusion. Final thing. Next. If you require further information, why should he require further information? If it is required, then why you did not give? Okay. If further information is required, why you did not give? That means required information is relevant information. Why you did not give? All the relevant information you should give. You self-defeating statement this is. If you require means required information, means relevant information, then why you did not give? Self-defeating statement. All the relevant information I have given you. Finished. But in spite of that, any additional information is you require, try to throw the ball into the other's court. I gave you all the information that you require, but in addition, you need something else. Okay. More than 100%. I already gave you 100%. If you want 101 or 210, I will give you, but you should ask that for. Come back to me, I'll give you. I have done my duty 100%. No doubts. That's the command. So that's why I tell you, in case Any additional information is required, not ordinary information, additional, more than what is relevant. If still you want something else, passive voice, please do not hesitate to contact me. I don't know how you people take that. I try to give my best possible options. And the points which I am giving you, okay. And don't go and ask some nurse, okay. Go and ask some teacher, professional teacher, okay, who has some certificate with, who has trained, because not ordinary things. The points, I think everything is in front of you. I'm not telling they're wrong. What you have written, they're right. But the quality, quality is very important. Quality is important. Quality of life, we call. Quality of life. Quality of presentation. Metformin, atorvastatin, lisinopril, nifedipine. Just checking for spellings. Nifedipine. Okay. And vitamin B12 supplements over the counter. Why did he give over the counter? What do you mean by over the counter? Don't you understand the difference of over the counter? It's not standard. It's not standard. She went and bought from somewhere. Over the counter. Just bought like that, without any label, without any name. Somebody said vitamin B12 tablets, supplements she took and using. Over the counter means unauthorized. Why didn't you not mention that one? Right. Okay. Now, you're writing to a surgeon. You're writing to a surgeon. Do you think he needs this information regarding which information is relevant? I've corrected your letter, but English side, I have done everything. But clinical side, you should see. Now I'm coming to that one. So for writing this letter, now you can see here, you're writing to a surgeon, the weight center. Okay. Surgeon at the weight center. See here, you can write this sentence like this. Maybe, possibly, once a month, monthly, binge, binge eating. Okay. Triggered by stress. Okay. Now you're writing what is important, what is relevant, that you can minimize and try to expand further. Remove the unnecessary information. Remove the unnecessary information. So you're writing letter to a surgeon, Dr. D. Kurag at the weight center. Okay. So all the other possible options gone. Yeah, that's it. So finally, so takes 3 meals. Right. First thing is what I noticed in this letter is copy paste avoid. Those which you cannot modify, those only you keep them as it is. For example, medical names like atorvastatin, surgery. These words you cannot modify. Okay. So those words you write. Other words you modify. Otherwise, it is like copy paste. Okay, diabetes mellitus, you cannot change. Hypertension, gout, these words you cannot change. Then if everything you keep there, then what is the use? There is no meaning. Medical terms don't change. Other terms, English terms, you can change. Don't use any English terms. That is a negative point. Right, that is it. This is the letter, and this letter is going to go to the first one. Yes, here it is. Yeah, one letter corrected. So from now onwards, it's a file save. Okay. So this is feedback. Okay, that's it. So now here we have review, track change. So this is your letter, original. This is your original letter. Okay, whatever you have given the original letter. Okay, these are the corrections. Fine, save, file save as PDF. Yes, copyright. Yes, I'm sending this document. This is the first in the series. So learn, go through this letter. You can write your letter on your own. All the students who have attended this session, go through this letter, and then afterwards you can write on your own. This letter you write, other letters you can write later. So syringe solutions. Syringe is for nurses. Once again, I'm giving you the link. Here it is. Sorry. Yeah. It's a lecture. It's not a writing correction. It's a lecture. So next letters in the same vein, it will be corrections only. So here it is. Yes. So your letter is here. So it is gone here. All right. And you can take it. So from here, this is a feeding channel. So it will go to classical corrections. All will go into classical corrections. That's the notion. Okay, here it will come. This will take you to syringe. And in the same way, from classical corrections, you have these letters. This will take you to another. This is doctor's letters. Okay, and all the students who are watching on the YouTube. Okay, so this is syringe solutions. Manage channel description. So this is for writing subscriptions for nurses. Those who want to have only writing corrections, 100 days. That is doctors 15,000, but nurses it is 7,500 only. And 30 days, 50 letters, it is 5,000 only. And 25 letters for 15 days, it is 3,000 only. Yeah. So for nurses, I'm giving you special price, half of that of doctors. So whoever is interested, you can approach me, and really serious you come. Otherwise, don't play with fire, because I can't take things lightly. When something is right, I have to give right. And now I know very few people will be there. Not many people will be there. Manpreet Kaur. Hello, Manpreet Kaur. Are you sharpening your sword or axe? I don't know.
Hello.
No. Are you sharpening your axe against me? Talwar, talwar. तेज
Hello.
बन. Hello,
Hello.
hello, talwar तेज कर रहे क्या रे? Are you
Hello, sir.
sharpening? Are you sharpening your sword?
No, sir.
I don't know. Okay, I used every instrument against you. Okay, now
Okay.
tell me, what do you understand?
I understand a lot of things.
Hmm. So was that beneficial for you?
Yes, it is very beneficial for me.
Don't sleep now. Today night you do all these things, and next letter should be dramatic transformation. That
Oh,
should be the notice. Don't say okay, okay,
I will try.
okay, fine. Not to try, do it.
Okay, I will do it.
Okay, fine. Okay then. So that's the end of the session. And what did you? Okay, so fine. Tomorrow I'll correct 2 letters for you, because you are going for exam, right? Okay. Then next, anybody wants to say anything regarding all the others went, only 3 students, 4 students are there. Anybody want to speak about the feedback? Attack. So Manpreet Kaur, M first. Manpreet Kaur finished. Meera Manoj. Have you to say anything, Meera Manoj?
Hello, sir.
Hello, Meera. Yeah, share your experiences, please. What do you think about the feedback?
It was good, sir.
Okay, what new things did you learn? Do you think that this letter which I have explained her how to correct, is this helping you in any way?
Yes, sir.
So in what way? Can you give 1 or 2 examples?
Passive voice, avoid personal pronouns.
Okay, that's fine. That's fine. Thank you very much for sharing your experience.
Thank you, sir.
Okay, next Nithya. Nithya. Nithya Menon. Okay, Nithya.
Yes, sir.
Yeah, Nithya, you are a new student to me. You know that. First time you are attending such sessions, right?
Yes, sir. Yes, sir.
Was that beneficial for you? Speak a little loudly because I'm old man. My ears are damaged already. Okay.
Uh, okay, sir. Okay, sir. It's very useful, sir. Actually, you're given a very good information. Thank you, sir. Because usually I start with I'm writing regarding that is style for all the letters. I'm writing like that only. But you have given the information not like a child. I am writing regarding like that. We have to start with the patient name. We have to go in a different style. That is very helpful for you to get like that. You told no, that's very useful for us for me, sir. Then you given me one information that you need to use passive voice.
Yeah, I will be
Then
teaching. I will be teaching. I will be teaching those.
then you have to use there for superlative degrees, and then you have to use the conjunctives like in addition to therefore, all those things you have to study. Then it is useful to for the essays like that. You told no, that's very useful for me, sir. I need to
Yes.
learn many things.
Yeah. Yeah. Thank you very much. Okay. Last but not the least, Ushani. Hello, Ushani. Ushani, are you there?
Hello, sir.
Yeah, Ushani, how are you?
I'm fine, sir. Thank you.
Yes, yes. Thank you for attending today's session. How did
Yes, sir.
you feel regarding the session? Was it practically beneficial for you?
Oh, yes, sir. It's really good because I want to know, make my errors. Uh, it's very important and beneficial. This is my
Okay.
first time in the writing. I think it's very important to be here.
Okay,
Thank you
fine.
very much, sir.
Thank you very much. Okay, so that's the end of the session today. And it's dinner time for Peter, sir. Bye bye. Have a nice day.